So good afternoon, everyone. Thanks for being with us today, and thanks for giving us an opportunity to present our study. My name is Sara. I'm one of the cardiology fellows at Mayo Clinic, and the title of our study today is Physical Training Augmented with Whole Body Electronic Muscle Stimulation is superior to conventional training alone in healthy subjects, a pilot randomized controlled trial. So starting with some background, we know that physical activity is protective against cardiovascular disease, disability, and death. And we also know that it improves cardiorespiratory fitness and cardiovascular risk profiles. However, we also know that more than 25% of American adults do not participate in regular physical activity. And we also know that a significant proportion of the elderly are either unable or unwilling to participate in levels of physical activity that meaningfully impact cardiovascular risk. And so novel solutions to help in this regard would be of great value. Whole body electronic muscle stimulation, or whole body EMS training, is a novel, FDA-cleared technology which provides for a time-efficient, customizable, individualized, and joint-friendly form of physical training. Whole body EMS involves a simultaneous stimulation of all the major skeletal muscles of the body, and preliminary studies have shown increased muscle mass, reduced fat mass, and enhanced physical capacity in elderly individuals who are sedentary after training with whole body EMS. However, the role of whole body EMS training on cardiovascular risk profile is indeterminate. Therefore, the aim of our study was to evaluate the role of training with whole body EMS on important biomarkers of cardiovascular and biomechanical health in healthy adults. And this was an industry-sponsored, investigator-initiated study. And so we performed a pilot randomized controlled trial in healthy adults who were randomized either to physical training with whole body EMS or physical training without whole body EMS. And this was for one session of 20 minutes duration per week across a 16-week period of time. As for the physical training protocol, study participants were asked to abstain from all other forms of physical activity and exercise during the study. And participants wore a specifically designed vest and arm and leg straps, as shown in the bottom of the poster here, which was connected using electrical wires to the whole body EMS device. Now, this device was manufactured by the company with whom we collaborated for this study. They're called Mir Bodytech. Their basis is in Germany, but they also have an office in the United States as well. And so biphasic electrical stimulation was delivered through the vest and the arm and leg straps in a 4-second on, 4-second off manner at a frequency that elicited a score of 5 to 6 on the Borg perceived exertion scale. Each of the major muscle groups were stimulated, and these included the upper back, the lower back, the latissimus dorsi, the chest, the abdomen, biceps, triceps, thighs, and buttocks. Frequencies were titrated across the first 4 weeks of the training protocol and then remained fixed for the remainder of the study. And individuals who were randomized to no whole body EMS stimulation wore the exact same equipment as the intervention group, but they received no stimulation, and this was an attempt to preserve single blind. Sessions were provided by trainers who were certified in providing whole body EMS training, and consisted of a fixed number of repetitions of a fixed program of exercises, which included things like squats, lunges, bicep curls, and so on. And for the statistical analyses, we measured a number of cardiovascular and biomechanical parameters at baseline and at 16 weeks, and we compared differences in these variables across groups. As for the results, 41 individuals were recruited between January 2021 and March 2022. 24 were randomized to training with whole body EMS, and 17 were randomized to training without whole body EMS. The average age of the population was 36. More than 60% of participants were female, and the median BMI was 24. And here we highlight some of the more interesting and important findings of our results. First, we showed significant differences in waist-to-hip ratio, such that individuals who were in the intervention group exhibited, on average, a decrease in waist-to-hip ratio of 1.2 centimeters at the end of the study. compared to controls who, on average, exhibited an increase in waist-to-hip ratio of 0.9 centimeters. And these differences between groups were statistically significant. Second, we also showed significant differences between groups in lipid profile, such that the group who received the intervention exhibited, on average, a decrease in total cholesterol of 1.1 milligrams per kilogram, while those in the control group exhibited, on average, an increase in total cholesterol of 14.2 milligrams per kilogram. And again, these differences between groups were statistically significant, and these changes were principally driven by a reduction in LDL cholesterol. We also looked at important markers of cardiopulmonary fitness, including anaerobic threshold. Anaerobic threshold is the level of oxygen consumption above which aerobic energy production needs to be supplemented by anaerobic mechanisms. And that, as a consequence, results in sustained elevations in lactic acid. And this is usually presented as a percentage of VO2 maximum. It corresponds with cardiopulmonary fitness, and it's associated with cardiovascular risk. And we showed that individuals who trained with whole body EMS exhibited an increase in their anaerobic threshold of almost 70% compared to controls whose increased only just over 30%. And we also looked at breathing efficiency, which is an index of how good our ventilation is at expelling CO2 when we exercise. Lower values correspond with better cardiopulmonary fitness, and this is measured in ventilation, or VE over VCO2. And we show that those who exercise using whole body EMS, their VE over VCO2 decreased on average by more than 10 points, whereas those who exercise conventionally without EMS, theirs decreased by just over 7 points. We also looked at peripheral endothelial function, which we measured with reactive hyperemia peripheral arterial tonometry. Now recall that endothelial function is the earliest stage of atherosclerosis. It's a strong predictor of cardiovascular events, even in individuals who have no or few traditional cardiovascular risk factors. And it's often viewed as an integrated index of vascular health. And we show that individuals who exercise using whole body EMS demonstrated stable levels of endothelial function from the beginning of the study to the end, whereas those in the control group exhibited, on average, a decline in their endothelial function. And then lastly, we also looked at a couple of biomechanical markers as well. Shown on the bottom of the graph, we looked at maximum peak force, which corresponds to strength, and we also looked at rate of force development at 200 milliseconds, which corresponds with power. And both of these were measured in the hamstring muscle. And we showed that in the intervention group, power and strength increased from baseline to the end of the study, and neither of these were shown in the control group. And these differences across groups, once again, were statistically significant. And so with this, we conclude that once-weekly physical training with whole body EMS under close supervision yielded significantly greater improvements in important biomarkers of cardiovascular and biomechanical health compared to conventional training alone. And therefore, whole body EMS could provide a time-efficient and effective form of physical training that could help with a regular uptake of physical activity, especially in individuals who ordinarily are unable or unwilling to exercise conventionally. Thanks for your time.
Thank you, Dr. Sara, for the wonderful presentation. I think, as we talked about beforehand, that this is a very novel study, a novel device. Open to the audience for any questions. I certainly have a couple. Yes, of course.
Hello, I did have a question about, so what do you guys think was the reason for the waist circumference increasing? And you said the total cholesterol was mostly driven by LDL cholesterol, so that would mean that the control group had their LDL cholesterol go up with exercising. So what do you guys think caused that?
It's a very good question. I'm glad you drew attention to that. So this is a group of healthy adults. Their average age is 36 and their average BMI is 24. And they self-selected to participate in this study. So we can assume that this is a healthy health conscious, probably regularly exercising group of individuals. We don't have the information to what degree they exercise at baseline, but I think we can safely make that assumption. So, and they were also asked not to participate in any other physical activity. So that means that if you're a control, the only exercise you're doing is 20 minutes of squats and lunges without any extra weights, without any extra bands, without anything extra. And the only thing that distinguishes them from the other group is the electrical stimulation. So it's a good point that it raising, the cholesterol and the waist to hip ratio increasing, it's not intuitive, but these are probably individuals who are doing dramatically less exercise than they ordinarily might. And the point is that if you exercise just once a week using WB-EMS, you can sustain the levels that you might have with 3 or 4 sessions of exercise ordinarily. We don't have the information to prove that, but I think it's a pretty compelling hypothesis in my view at least.
How much does this cost? Is this, I guess, what's the timeline for this maybe, down the road being available for the larger population, or is this maybe going to be a boutique therapy for
So it has utility in different spaces and different populations. It depends what you're looking for. It's already available commercially, and you can find studios that provide for this throughout the US, throughout the world in fact. It's, like I said, it was developed in Germany, but there's offices in Europe, there's offices throughout the United States. It does have that boutique element to it, but obviously our goal is to introduce into the medical space, where I think it has a lot of opportunity. If it really provides these sorts of improvements in healthy adults, what I find most compelling and most attractive is what could it do in unhealthy elderly individuals who have frailty, who have established cardiovascular disease, and who otherwise can't do cardiac rehabilitation 3 or 4 times a week. So the medical space is where we're targeting, but it's already available commercially.
Did you track their nutrition intake and then weight as well?
We do have the information on weight, but we don't have nutrition intake. That's very important. So the technology is from Germany, and there's a university close by to the head offices in a town called Nuremberg, I believe. And they've done a lot of studies here, not as large as ours, and not in people looking at cardiovascular outcomes and cardiovascular risk profile. And they did focus on sort of protein intake and so forth. That's an important next step. I think obviously we all know nutrition has an important role in cardiovascular health. And how that combines with EMS, we don't know yet, but it's definitely something we're going to explore in our future study.
Looking at the BMI, a lot of us see patients that have much higher BMIs. And so as far as the feasibility, this vest, does it come in different sizes?
It does, yeah. It's you get different sizes. You get adjuncts that you can make the sizes large. And some of this is an average BMI. There were certainly individuals whose BMI was far larger than this as well. So the technology is very customizable, and it does accommodate larger patients. And I think there's definitely an opportunity for some of our cardiac patients here as well.
We're a little ahead of schedule, but just one last question, unless there's more from the audience. I noticed that the frequency elicited a score of 5 to 6 on the Born scale. Were there any sort of qualitative descriptors that people use, like, oh, this is what this the stimulation actually felt like?
Yeah, so the trainers who do the training, they ask participants to describe what the muscle stimulation feels like. 0 is regarded as you can't feel anything, and 10 is as if your muscles feel like they're going to explode. And so that's the sort of nomenclature that we use, take it as you will. It's a useful sort of guide, I think. And so we're looking at somewhere halfway between that. It's subjective, we acknowledge that. But I guess the stimulation in exercise, if you do it in the gym or if you do it on the track, it's subjective there as well. So it has that individualizable component, but we use the scale as closely as we can.
Great, thank you so much.
Thanks everyone.